welcome to Inside Healthcare. Public health officials say you should be aware that the COVID virus is still with us this fall. The variant EG.5 is dominant and spreading, but experts say it is no more dangerous than previous variants. Check with your doctor for more information about COVID testing and treatments now available. And with the flu season fast approaching, health officials say the fall is the best time to get your flu shot, which is the most common and important ways to protect you and your family from getting the flu. mHealth Fairview and Woodbury Thrives are offering a free flu clinic on Saturday, October 28th at the Woodbury Central Park. No appointment is necessary. And we also take a moment to talk with health officials about colon cancer, which is one of the most common cancers, and why doctors say this cancer is almost 90% preventable. mHealth Fairview tells us who is at most risk for colon cancer and how it can be prevented. Here is Francisco Ramirez. Francisco, can you tell us about colon cancer? What should people know about colon cancer?
Yeah, well, colon cancer is a cancer that develops in the tissues of colon and rectum. And according to the American Cancer Society, excluding skin cancer, colorectal cancer is the third most common cancer diagnosed in both men and female. And unfortunately, is also the third leading cause of death in both men and female. That's why it's extremely important to be aware about the risk factors, symptoms, and actually how we can prevent this.
And what would be some of those risk factors, and who is at risk for getting it?
And some of those risk factors, there are like older age. Of course, we cannot change our age even if we want to. But every person, female and male, that are older than 45, the risk increase at that age. Also, African American communities, Native Americans, Latinx communities, we are in a higher risk for colorectal cancer. Also, a personal history of colorectal cancer is a risk factor. Those kind of like family history, not only with colorectal cancer, but also with polyps. Then your diet, if it's not a good diet, you increase your risk for colon cancer. When you don't do physical activity regularly, you increase your risk. People with diabetes, obesity, overweight, they have a higher risk for colon cancer, unfortunately. Some of those are some of the risk factors for colon cancer.
You know, it's important to know that too, because I understand that it is almost, I don't know, is it 90% preventable?
Yes, it is. And actually it's treatable when you kind of like, when you do the screening, and if you find these polyps or even like cancer on time, there are like so many like treatments and also like ways to give you medical attention. Then it's extremely important to go and do those screenings. Then we just want to remind our communities, our diverse communities, that colorectal cancer screening save lives. And then there are so many times when I am with the community that they say, well, if I don't feel anything, I don't see a reason to do this. But that is so important to be aware that this is a lot of stuff that we can prevent, like this cancer, but we have to recognize the risk factors that we already mentioned, and also some of those symptoms.
And I know mHealth Fairview wants to bring awareness to colon cancer. And what is the organization? What are your programs? What do you offer for prevention, treatment, things like that?
Yeah, and then before I share that, I want to share with the community that they have to be aware of the symptoms and then or signs or symptoms that when they feel like chronic, or when they have like chronic diarrhea or constipation, if they feel abdominal pain or rectal bleeding, or if for whatever reason they start like losing weight with no reason, then those signs and symptoms are kind of like a red flag, and they should like talk with their medical provider to see which screening they should do. But mHealth Fairview, and I want to say thank you so much to our mHealth Fairview leaders, the amazing GI providers and great nurses that we have in the system, and everybody involved with this program. Since the spring of 2014, we started at Fairview Southdale with a free colonoscopy program at Fairview Southdale. And then there is a group of physicians that every year they get together and then they provide these free screenings for our communities, our diverse communities. If anyone is between 45 up to 75, if they live in Minnesota and if they don't have any medical insurance, we provide these screenings. We would like to provide these all the year, but there is a time of the year that we provide these. And we just finished this year between Fairview Southdale, Fairview Regis, and St. John's hospitals. This year, they did like 60 free colonoscopies. But since we started back in 2014, the GI providers have provide over 300 free colonoscopies, and we provide like the education, the outreach. We met with the patient and we help them to navigate the system, and we explain step by step how they need to be ready with the prep, which diet they need to, what they need to be, and then we follow up with them after the colonoscopy to see how they are doing.
How can our viewers get more information about the free screenings that you provide?
Yeah, and we finished for this year, but for 2024, they could like call to the 651-279-5668, 651-279-5668 to get more information, to see if they qualify, and everything is confidential. We provide all the medication, all the education free. We are going to start like next year around like the summer, around June, July. But if they call us before, we can definitely kind of like put them on the list and make the connection with them next year around June.
Any final comments for our viewers about colon cancer?
Well, I just want to say that we need to be aware that there is still a lot of work to do with like free colonoscopies, like free detection programs. And we are working together with the American Cancer Society, St. Mary's clinics, many community partners, the Cook Clinic in the Twin Cities. What we believe is that leading through change, we are leading through change to find new opportunities to keep working together with our communities. Our goal is to have like healthier communities, and then there are so many ways that we can work together with health education. And remember, then prevention is better than treating patients, is better than curing patients. That's what I'm trying to say.
Well, thank you, Francisco Ramirez. As always, it's a pleasure to have you on Inside Healthcare.
Thank you.
Most of us like to be out in the sun. That's why sunscreen and other safety measures are key to protecting your skin from aging and cancer. The FDA recommends using a sunscreen with an SPF of 15 or higher. Also, look for broad spectrum on the label. That means both harmful ultraviolet A and B rays are blocked. Remember, SPF plus broad spectrum equal healthy fun in the sun. Visit www.fda.gov/sunscreen for more information. A message from the U.S. Food and Drug Administration.
Welcome back to Inside Healthcare. Kids are back in school, and public health officials say students learn better when they are well nourished. Now kids in 8 states, including here in Minnesota, can eat free school meals this year thanks to a new law and state funding. Community gardens can also help promote access to good nutrition, as well as encourage active and healthy lifestyle and improve mental health and well-being and inclusion for a sense of community. To talk about the benefits of community gardens and tips on what you can grow this fall, we are extremely very pleased to have with us Ying, a community gardener, and Ed with the Washington County Master Gardener. So thank you both for being with us. I really appreciate it, and getting you out of the heat and into the studio here. Probably just as hot as being outside. So Ying, I know that you have done this community garden. Tell us what that means to you to have a community garden. What is that all about?
This community garden is truly a blessing for me because I have always wanted to grow vegetables. It's a long time dream of mine. But I don't have enough space in my backyard. So every winter I would look through kit seed catalogs and imagining, what I can grow, but then I have to put the catalog down because I don't have space for it. So I heard about the garden, I was really excited.
And what are you getting out of it personally, being a part? Why is this such a true blessing for you?
So beside being able to finally grow things, also to meet all these other gardeners who enjoy the same thing, who are passionate about the same thing, and learn from them. There's an incredible diversity of people and things being grown in the community garden. I really learned a lot.
Has that really surprised you? Were you anticipating that you would have that camaraderie with the others and stuff like that?
I sort of expected it, but it was more than I expected. Yeah, the variety of things, how helpful and willing to share people are. Yeah, and also the master gardeners and giving all these talks about different things. I really learned a lot. Yeah.
It is a blessing to have someone like Ed as a master gardener with us. I know that there's community gardens all over in Minnesota and stuff, and that one of the newer ones is the Woodbury Community Garden. Tell us about that exactly.
The city of Woodbury did a survey several years ago, and it kind of surprised them that having community gardens was at the top of the list. And so they looked at the other cities, and Woodbury was the largest city in Minnesota without a community garden. And so they decided to start a community garden, and they got a committee together of about 8 people to get it started 3 years ago.
As a master gardener, what do you enjoy being involved with the community garden then?
I enjoy working with people. I'm a carpenter, so I enjoy building things, so I got to do some of that, but more to work with people that enjoy it and have a lot of questions. And I'm like Ying. One of the things that surprised me
I was just going to ask,
was that after about a couple weeks, they started interacting so much they weren't asking me as many questions because they were getting the answers from other gardeners in the garden. So that was quite a surprise.
You know, you were saying that you didn't have that opportunity, Ying, to have a community garden or to do a garden. So how did you decide what to put in the garden? And you've brought some of the products with you today.
Yeah, so I always wanted to grow things that I grew up with from my childhood. So that's one thing. Another thing is I'm very curious about other culture and what other different vegetables that they have. So I'm always into trying new things. This year I mainly focused on the things I used to know. Like for example, tomatoes. Why? Was little, I remember in the marketplace, tomatoes were sold both as a fruit and a vegetable. But when I come to America, the grocery bought tomatoes, they just don't taste the same. There's no way it can be eaten like a fruit. So I finally get to grow the kind of tomato that's bring back childhood memories.
Oh, wow. Yeah, that brings back to my dad and my family also growing tomatoes too.
Yeah.
Same thing. It's not quite the same what we might find at the grocery store and stuff like that. And then you brought some ones specifically that we're looking at here that you brought? Yeah,
so this is a winter melon. This is also a very Chinese vegetable. It's in the cucumber family. It doesn't really have a lot of taste to itself, but it absorbs flavor from other things. So I'm going to make soup with it using ham and tofu.
Oh, that sounds great.
And this is a Korean sweet melon. And then this is a Japanese sweet melon. So those are 2 new things I'm trying this year. And you don't usually see them in the grocery store. And this is a round eggplant. Yeah.
And Ed, you were saying this is a good time also to for fall things, what would be some of the people that can plant now for the fall?
The same thing that you would plant early in the year that
See, I
can
would have
stand
no
the
idea.
frost, and that would be like kale, spinach, beets, things like that can take a frost.
And do you have to do anything special planting now at this time of the year?
Nope, just plant them and hope that the good hard freeze won't come early this year.
And is it good to have, what would be the type of plants or vegetables that you would recommend specifically?
In a garden?
Yeah.
Yeah, the green beans, tomatoes, squash. In a community garden, it's a smaller space. The spaces are 9 by 14, so you're a little bit limited. But you can get a lot of good vegetables in there if you do things like read the square foot gardener, and so you try to plant one thing in each square foot, and so you can get more vegetables and varieties.
And what plants are more native to Minnesota as well that you would recommend?
The squash, there's several squashes. Zucchini is very popular and pretty prolific. You don't want to grow any perennials, so you don't put raspberries and berries in there, or strawberries or things like that.
And is it too early to start think about planting things for a spring harvest and stuff like that?
In Minnesota it is, because of the winters are so hard. About the only thing you can plant now would be onions and things like that. So that's about all you can plant now. They'll make it through the winter and then be there in the spring where you can harvest it.
Any tips or advice for someone maybe who's a novice at planting and stuff to get success? I mean, what would you recommend, like for tools or things that they should be doing?
Well, the first thing for a novice gardener is to do a soil test to see what nutrients it's missing, so you know exactly what to add, because you can over-fertilize. And then put the spade in the ground and see if the ground is loose. Does it need any amendments like mulch or compost to help it along? And the more compost it has, it absorbs the water and holds the water.
You know, and it's been kind of it seems like a tough year for growing with lack of water, especially around here. Any advice for people, whether if they're still have their crops or their plants, or they're planning on planting stuff, to make sure that they get enough moisture and water and stuff like that?
Yeah, the drought has been pretty tough, and it's been really tough on tomatoes particularly. You have to water those almost every other day. But the green beans and squash and the big leafy vegetables can usually stand the drought much more so than like tomatoes that are very sensitive.
Yeah, it looks like the heat is going to be with us for a little bit longer here yet.
Yep.
And then anything that you had learned that you wish you would have done differently, having gone through this, first experience with the community garden and stuff?
Yeah.
What were lessons that you learned?
First of all, I think some of the, like the corn, I grow them too close together.
Oh.
Yeah, so I grow 4 rows. Only the outside 2 rows had good yield, and the middle 2 rows I produced very small corn. Yeah. Also, I learned from other gardeners how to prop up, how to support tomatoes. When they grow pretty tall, yeah. I used a tomato cage, but they wasn't sturdy enough, so there's a more sturdy way to support them.
Wow.
Yeah.
Great lessons that you learned, though.
Yeah.
Final comments on where people can get more information and things like that?
Yes, the University of Minnesota has a website that's very useful. There's thousands of pages, so you go to that. It's www.extension.umn.edu/garden, and once you get started, you can drill down into any subject you want to do with gardening.
Well, you're such a resource of information. I would go, call Ed. Well, really a pleasure to have you both with us, and thank you so much. Really appreciate it.
Thank you.
Yeah, thank you for
Great
having us.
advice. Still ahead, we talk with a local doctor about ways to prevent fall sports injuries, so stay with us.
If you love them enough to relearn math so you can teach them math, then surely you'll check nhtsa.gov/the-right-seat to make sure they're correctly buckled in the back seat.
Finally, fall sports are back in full swing. Doctors see an increase in sports-related injuries every fall. Dr. Kristi Trussell with the Urgency Room talks with us about the most common injuries she sees and tips to prevent them. Dr. Trussell, why don't you tell us what are some of the most common type of injuries that you're seeing during the fall sports, with kids and of all ages? What are some of those things that you see?
Well, back to school often means back to school sports too. So we, at the urgency room, we see a lot of different sports related injuries. One common example would be a knee injury from a sport like soccer, where you twist and pivot and then injure the knee. Other common injuries would be ankle injuries, ankle sprains, or even ankle fractures. And as always, a fall can always end up landing on an arm and injure the wrist or the elbow. So we see a lot of fractures, a lot of sprains, and then sometimes those knee injuries are even bigger deals with injury to the ligaments like ACL tears and that sort of thing.
Are there certain sports that you're more likely to see these type of injuries? And then are there certain ages that are higher at risk for these?
Well, injuries can affect all sports and all ages. Soccer, we tend to see some of those injuries to the knees and the ankles. Higher risk sports, football comes to mind as we enter into the fall with that risk for concussion and other types of head injuries too.
It seems like, at least when I've observed too, in all different ages and in sports, that the coaches seem to be more attuned to and aware of more concerns and things like that. But we've had so many really hot, humid days and things like that, and that's going to continue during this fall here. So what would be some of those heat-related type of injuries that you see, and what would be the symptoms of them?
So certainly athletes, particularly if you're doing back to sports, prolonged fall practices, are at risk for heat-related illness. Heat-related illness is actually a spectrum of illness, anything from heat cramps, which are pretty mild early signs, all the way up to heat exhaustion, which is a true heat exhaustion, which is more symptoms, nausea, fatigue, vomiting, sometimes feeling a little fuzzy, to heat stroke, which is a true medical emergency for which you would call 911 for change in mental status or seizure, things like that. As kids head back to sports, it's just important to be cognizant of what the heat risk is for the day, how hot and humid it is, making sure they maintain hydration, and then taking breaks, particularly if it's really hot out.
You're talking about hydration. How do we know if they've gotten dehydrated and things like that?
So there's no specific amount of liquids that's absolutely the right amount, but making sure you're taking breaks to drink, drinking if thirsty or even a little bit before thirsty. It's also important not to over push fluids. So there's a balance there.
And how do you know how much? I guess it really depends on the individual, but I mean, how do you know how much is too much, or what should they be doing? And should it be before they have the exercise, or during the exercise, or after, or all of the above?
It's certainly important to come into strenuous exercise well hydrated. You don't want to be behind. There's no specific amount that is right for every individual, but you certainly want to be able to have particularly if it's really hot, you're sweating a lot and working hard, be given the time to take breaks, cool down, have some drinks. A good just general hydration tip is that adults should be going to the bathroom to urinate and making fairly clear yellow urine at least a good couple of times a day.
And I know it's really important for any student or athlete to make sure that they have a physical before they participate, and what's involved with a physical sports physical?
Many sports require a physical before starting the season. And what that's really looking for is any underlying medical problem that would affect your ability to perform or even put you at risk for a dangerous event. In the news, we've heard some stories about high-level athletes having cardiac arrests. And one component of a sports screening physical is to assess any risk for cardiac events. The doctor or provider would listen very carefully to the child's heart and make sure that there's no murmurs or other risk factors for a sudden cardiac event. And also just reviewing underlying medical problems, making sure plan for activities in place if there's any chronic conditions.
And you mentioned earlier about emergency care and stuff. When should a student or a parent bring their child to their urgency room for emergency care?
We certainly see a wide variety of sports-related injuries. We are fully equipped to evaluate concussion and head injury. The initial evaluation of concussion is history and exam, but certainly we can obtain a head CT if we think there's risk for skull fracture or bleeding in the brain. We're able to do good evaluation for sports injuries. We have X-ray and even CT if necessary. And we're certainly happy to evaluate underlying medical issues too.
Absolutely. And final comments for our parents, for our students, how to stay safe and stay healthy during these fall sports.
Yeah, fall sports are such a great component of back to school. We'd be happy to see you for any of your sports injuries. As you return to sports, gentle ramp up and to get back into your sport, work closely with your coach and have a great season.
That's our show for you. Join us again next time on Inside Healthcare. We'll see you then, everyone.